My name is Richard O'Brien. I'm a professor of neurology at Duke, and I'm chairman of the Department of Neurology. I was intrigued by the ability to mix kind of the humanism that comes with being a doctor with science and research, which I spent a lot of time doing as I went through my training. I've always liked that about my job, the fact that I'm both able to see patients and study their diseases in the lab, so it kind of brings the career together. I see mostly patients with memory disorders. Sometimes I see people who have primarily walking problems. In addition, almost all my patients are elderly. It would be patients who have Alzheimer's disease or other forms of dementia. In those cases, I'm seeing two patients. First is the person with the disease, but even more importantly is the person taking care of that person with the disease. We call them the caregiver. They need as much attention as the patient does because they're under a lot of stress. There are some medicines we use for the diseases, but their effect is fairly limited. We try to treat depression and behavioral problems, but most of the time it's about a partnership between the doctor, the patient, and the family, trying to keep the patient safe and happy and as healthy as possible. Taking care of patients, elderly patients with memory problems, is a relationship business. The family and the patient have to trust you. I take that very personally and seriously, that they're investing this faith in me to care for their loved one through this disease process. I really enjoy older folks. I didn't know that when I was in training that I liked older folks, but for some reason they like me, I love them, and we get along well.